talking to you a little bit about childhood obesity today. So this is a 6-pound medicine ball. It doesn't look like much, but for a small enough child, this much weight can make the difference between a healthy start to life and a lifetime of increased health risks. Childhood obesity is important to each one of us in this classroom because it may have affected us as children, might affect the children we know, or the children we have or may have one day. Childhood obesity has become a public health crisis over the last few decades, and it has many short and long-term health risks associated with it. My interest in this topic stems from my interest in public health and nutrition as a career, and I've read several medical and scientific peer-reviewed journals to provide you with the information I'm going to share with you today. I'll be talking to you about what childhood obesity is, its prevalence, the health risks associated with it, and the programs that are available to help. Childhood obesity is a medical condition, which, according to the medical journal Practice Nurse, is determined most commonly by body mass index, or BMI. Rona Mooney of the World of Irish Nursing and Midwifery says that a child whose BMI is in the 95th percentile or above, which is this little red range on this chart, is considered obese, and between the 85th and 95th percentile is considered overweight. Now, looking at the chart, you wouldn't think it's really all that common because that normal range takes up just as much as the overweight range on the chart. But a study done from 2009 to 2011 by the Journal of School Health showed that in the Philadelphia School District alone, 17% of the children in grades 1 through 12 are overweight, and another 20% of them are obese. So that means that 37% of the school population is overweight or obese. Sabrina Darwish of Primary Healthcare Medicine cites the United States Department of Health's prediction that by the year 2050, 20% of the children in the United States will be overweight or obese, and the Philadelphia School District is already over that number, and 2050 is still 37 years away. Dr. Elizabeth R. Polgarone of Clinical Therapeutics magazine shows that this problem is not just here in the United States, though. Global estimates for children who are overweight or obese are 43 million. So now that we kind of understand that it's really a common problem, and we can start to understand it as a medical condition. Dr. Polgarone goes on to say that the effects of childhood obesity are far-reaching. They don't just include physical and health problems, they can include psychological, social, and behavioral problems as well. Among the medical problems she lists are high blood pressure, high cholesterol, metabolic syndrome, type 2 diabetes, orthopedic problems, sleep apnea, asthma, and fatty liver disease. She also mentions hypertension, which, according to my anatomy textbook, Anatomy and Physiology, the Unity of Form and Function, is chronic resting blood pressure of 140/90. Now, to put that in perspective, normal resting blood pressure for a 20-year-old male is 123/76, and for a 20-year-old female is 116/72, and that number should actually even be lower for children because blood pressure actually rises with age. This picture from one of the faculty members of Messiah College's websites shows even more of the problems that children can develop that are overweight or obese. Besides this whole plethora of medical problems, Dr. Polgarone goes on to list that children who are overweight or obese can have psychological problems such as anxiety, depression, ADHD, or just general behavior problems. Also, the Brown University Letter of Child and Adolescent Behavior shows that children that are overweight or obese in 3rd through 6th grades are significantly more likely than their normal weight peers to be bullied, regardless of a bunch of sociodemographic factors. So, now that we kind of understand it as a medical problem, we can begin to understand how the world of public health is addressing it. The American Journal of Public Health shows that policymakers are now turning more and more attention to making obesity legislation a priority. One of the most paramount acts in starting this whole obesity policy programs was Arkansas's Act 1220, which uses 6 points to try to increase the education and nutrition of their children. Those 6 points are setting up an advisory committee, setting up a nutritional committee, BMI screening through the school, restricting vending machine access, and having health professionals set up more school programs that will teach children to be healthy. But it's not just Arkansas State that is trying to regulate obesity and become involved in it as a public health topic. The federal government has also become really involved in this. Janet Adamy's February 9th, 2010 article in the Wall Street Journal highlighted Michelle Obama, that's Mr. Obama's wife, highlighted her role in their Let's Move campaign, which is designed to help children get out and play. The Journal of Law and Education shows, though, that this is not her only sort of push for childhood obesity legislation, and it highlights her role in passing the Healthy and Hunger-Free Kids Act, which was signed into law on December 13th, 2010. But, again, not just the government is trying to help, and an article in the Public Relations Newswire, United States, on September 1st, 2011, was talking about Nickelodeon's Worldwide Day of Play, which I'm sure several of you that watch the Nickelodeon channel have heard of. And Tara Parker Pope's May 10th, 2007 article in the Wall Street Journal highlighted the town of Somerville, Massachusetts' Shape Up program to help their children get out and play and get good nutritional information. So these programs are a good start, but it remains an epidemic. It's a medical condition whose prevalence rises daily, and it has long-term physical and social effects. There are many treatments and government programs available to help, and since it's a public health crisis, the first step to really addressing any public health crisis is to educate the public. So now, hopefully you, a portion of the public, have come to understand a